Hello everyone and welcome back to the channel. Today I'm going to talk to you about the pneumococcal vaccine. Why is it important to get it? What types are they and who should get it and when? Pneumococcal vaccination actually is a very important preventative healthcare measure and it reduces the risk of pneumococcal disease. It is indicated for adults with risk factors for pneumonia. Most common bacteria causing this is Streptococcus pneumonia, and it is the leading cause of pneumonia and meningitis in children younger than 5 and older adults worldwide. Streptococcus pneumonia is a gram-positive bacteria. It replicates in chains and appears as lancet-shaped diplococci. Some other causes of pneumococcal infection include meningitis, bacteremia, and otitis media. So let's jump into the types of vaccine. We have the conjugate vaccines and the polysaccharide vaccine. The conjugate vaccine includes serotypes 7, 10, 13, and 15. 10 and 13 valent vaccines, they are used around the world and they appear to be similarly effective in reducing the incidence of invasive pneumococcal vaccine. The 7th valent vaccine is no longer available and the 15 valent vaccine has not been licensed in the US. So the two kinds of pneumococcal vaccines are number 1, the polysaccharide vaccine, also known as Pneumovax, and number 2, pneumococcal conjugate vaccine known as Prevnar 13. The recommendation for initial vaccination includes the following. So if you're an adult, you're aged 19 through 64 and you're a healthy person, pneumococcal vaccination is not indicated. If you're an adult and you're again age 19 through 64 but you have a chronic condition but you are immunocompetent, then the recommendation is Pneumovax. That is the 23 valent pneumococcal polysaccharide vaccine. It is indicated. So what are the chronic conditions? That means chronic heart disease such as heart failure, cardiomyopathy, chronic lung disease such as asthma and COPD, chronic liver disease, poorly controlled diabetes, current cigarette smoking, alcohol use disorder. Prevnar 13, the pneumococcal conjugate vaccine, is generally not indicated for these patients. But again, you can consider them on a case-to-case basis once the patient reaches age 65. Patients at risk for meningitis, then we give both. We give Prevnar 13 and Pneumovax 23. So it's usually a single dose of Prevnar 13 and it's followed by the Pneumovax 8 weeks later for adults. Jumping on to immunocompromised patients, which include impaired splenic function, HIV, chronic kidney disease, leukemia, lymphoma, multiple myeloma, generalized malignancy, solid organ transplantation, hematopoietic stem cell transplant patients, people who are on long-term steroids or undergoing radiation, congenital or acquired immunodeficiency. Again, we give a single dose of Prevnar 13 and then we follow it with Pneumovax 8 or more weeks after that. Now, moving on to adults age 65 years or older, vaccination with Pneumovax is indicated for all adults over the age of 65. Usually in those cases, Prevnar 13 is not used for these adults. Unless, again, you have an indication such as immunocompromising situation or you've had a history of a very bad invasive pneumococcal disease in the past. So then it comes to now, we've done the vaccination, some of them are earlier. Do we need to revaccinate after a certain time? Patients at risk should be revaccinated with Pneumovax at 5 to 10 year intervals because the antibody response wanes over time. Revaccination with Prevnar 13 is not recommended for any age or risk group. What does the vaccine administration look like? Both pneumococcal vaccines are administered as a 0.5 ml dose. The Prevnar 13 should be given intramuscularly, whereas the Pneumovax can be given either intramuscularly or subcutaneously. Some safety or adverse effects of these vaccines. Again, injection site reactions is the most common adverse effect and usually ends in 3 to 4 days. Other systemic symptoms again include fever, chills, fatigue, headaches. And interestingly, if you look at my other topics such as the COVID-19 vaccines and shingles and all that, they all have these very similar reactions. So this kind of concludes our talk on the pneumococcal vaccine and its importance in society. So don't forget to comment or ask any questions that you have, and if you're interested in any other topics, please comment below. Don't forget to subscribe and also like the video.